What's up guys, this is Jeff from Sorta Healthy, and today we are back to talking about program design. Specifically today we are focusing on a group that you will 100% be working with as a personal trainer. Today we'll be focusing on how you should go about working with clients who suffer from back pain. And considering around 80% of people experience back pain at some point in their lives, yeah, I think it's pretty obvious as to why you as a trainer need to be so skilled in this area. A few things that we'll cover specifically in this video are: how do you figure out if your client has back problems? How do you figure out what's causing your client's back problems? And we'll also discuss how you as a trainer should help your clients deal with their back issues and help them prevent future back issues. Before we get into all of that, the only thing I ask is that you consider liking the video and subscribing to the channel if you haven't done so already. This helps the channel to grow, which allows me to make more free content for all of you. Thank you very much for the continued support, everyone. Now let's get into the rest of the video. So first things first, how do we find out if our client has any back pain or issues? Well, this is information that we should be made aware of during the initial meeting with our client, aka the consultation. A good consultation should include goal setting, rapport building, and you and your client filling out the necessary health history screening. You and your client have to fill out the PAR-Q, the health history questionnaire, and the informed consent. What I suggest to you, the trainer, is that you read each of the questions on these forms aloud to your client. Not only is this good for rapport building like we mentioned before, but it's also useful to help your client understand each of the questions that is on each of these forms. For example, on the PAR-Q they ask, do you have a bone or joint problem that could be made worse by a change in your physical activity? If someone has moderate to severe back pain, then the answer to that question could be yes. In which case you would then have to refer that client to a medical professional to get clearance before beginning an exercise program. On the copy of the health history questionnaire that I use, towards the end of it, there is actually just a yes or no question asking the client if they have back pain. So as you can see, if you're able to successfully guide your client through all of these forms in the beginning, you're going to be very aware if they do currently suffer from back pain. I'll repeat it again here. It's good to read these forms to your clients, use it as a way to get to know them a little bit more, and to understand what they have going on physically. In the next session after my consultation, I always do an assessment with my client. In that assessment, I typically do the functional movement screen with them, and that can also be a good tool for uncovering back issues. To access consultation, assessment forms, or the PAR-Q, health history questionnaire, or informed consent forms, you can go to this link in the video description. They're all free. We also have videos here on YouTube for both a consultation and assessment too, so make sure to check those out if you have any questions on how to do them with your clients. Next up, we need to talk about some of the most common causes of back pain. I'm just going to cut right to the chase on this one. Posture is the real killer here, and let me explain why that's the case. Here we're looking at some common postures. If you're working with the general population, the ones that you'll see the most often will be these three right here. Yes, that's right. These three compromised postural positions will typically be more common than good or adequate posture. Why is this the case? Well, most people are sedentary and they spend most of their lives seated, leaning forward far too much. This has consequences that we're about to discuss more. Let's start with the lumbar lordosis posture, or the famous Instagram butt posture. What do you do when you get a client like this? Basically, what we need to do is to get them to engage their core, and we need to also strengthen the entire backside of their body. Have them do exercises like the dead bug and plank to engage their transverse abdominis, the deeper, more elusive core muscle. Honestly, just have them do more core work in general. These are just some of the more effective ones to choose. If we have a client doing a dead bug and they have a fair amount of lumbar lordosis, cue that we could give our client is to tell them to squeeze their abdominals as tightly as they can and to try and keep their back as flat to the ground as they can. Sometimes if I have a client doing a dead bug or an exercise like a dead bug, I tell them to pretend that there is a water balloon underneath their lower back, and I want them to try to crush or pop that water balloon with their lower back. Sometimes visual cues like that are really useful to get your client to do something that you want them to do. In addition to strengthening this client's core, we also need to spend extra time strengthening their entire backside, in particular their glutes and hamstrings. As we can see here, this client's pelvis tilts forward. Clients who have this excessive forward lean that we see here will have very tight hamstrings. My question to you though is, what should we do about it? If in your head you said something like, well Jeff, his hamstrings are tight, so therefore we need to stretch out his hamstrings to loosen them up. Fortunately, if you were thinking something along those lines, you're not exactly right. This client's hamstrings are tight, yes, but they are tight because they are overstretched, not understretched. The hamstrings attach to the pelvis just below the butt and insert behind the knee. This person over time has contorted their body in such a way where they have increased the distance between those 2 points. So again, their hamstrings are not short and tight, they are long and tight. Their hamstrings and their glutes to some extent are like rubber bands stretched to the max. And no surprise, this ends up putting a lot of extra pressure on the lower back because these over-tight, overstretched muscles are constantly pulling on the lower back. And to fix this, we do need to strengthen our client's lower body. Deadlift, squats, lunges, step-ups, bridges, the usual suspects do a great job here. You just may want to prioritize glute and hamstring work even a little bit more than usual. If you sign on a client who you suspect shouldn't be doing some of those exercises that I just listed because it could make their back aggravated, hold that thought, and we'll be getting to clients like that very soon. Next up, let's check out clients with kyphosis or noticeable rounding of the upper back. In 2021, it's almost rare to see someone who doesn't have this going on. Let's also lump this in here as well. Most of your clients will have both of these two things going on at the same time. In fact, a large number of your general population clients will have all three of these things going on at once. Symptoms of these two postures include neck, back, and shoulder pain. Headaches are also very common with these clients. These are the clients that are going to complain about the knots that exist on their upper back, usually around the shoulder blades, somewhere around here, and they get oh so tender and ouchy. Well, I can tell you this, these clients don't have knots, they have bad posture. At least that's what's going to be the case for the vast majority of people in this situation. When we deal with kyphosis, we are looking at locked long muscles in the back. They are too weak and are losing in a game of tug of war to tight muscles on the front due to slouching. So how do we fix it? Well, in the gym or studio, we have our clients do lots of pulling exercises. A 2-to-1 pull to push ratio works really well here. And if working on pain in the upper back, neck, and shoulders is a huge priority for your client, you can even do a 3-to-1 pull to push ratio with those clients. Over the course of a week, if I do 3 sets of bench press and 2 sets of push-ups with my client, this is 5 sets in total of pushing. I then need to do 10 sets of pull exercises over the course of that week to achieve a 2-to-1 pull to push ratio. We also want to stretch out these clients over tight pectoral muscles. Have your clients in this category do the door frame stretch for 30 seconds a few times throughout the day. Also, chin tucks can be useful with clients with a lot of this going on right here. For all 3 of these postures, what your client is doing when they're not working with you or just going about their everyday life is equally, if not more important than what you're doing with them in sessions. This means that you need to get your clients with these issues to do some homework. All 3 of these clients need to focus on sitting and standing up taller throughout their day-to-day life. Their slouching is a huge part of their problem. This person needs to engage their core way more often, and periodically they should practice that while they're at work throughout the day. And they should probably do some extra core exercises even when they're not working with you. Clients who are stuck in this position should add the door frame stretch a few times a day for about 30 seconds each time. And this client should be doing chin tucks on a regular basis. For some clients, you might even want to ask what position they sleep in. Stomach sleeping can worsen a lot of these postures and back pain in general, so it's something that could be worth discussing with your client. Now let's discuss clients who come to you with more specific back issues. Maybe they got into a car accident, or maybe they slipped a disc doing yard work. In situations like these, the first things that client should do is see a doctor or a physical therapist. We as personal trainers are not supposed to diagnose or fix acute physical problems. We help clients to fix their lifestyle and some chronic problems. Again, it's not in our scope of practice to deal with more acute, serious issues like falling down a flight of stairs, for instance. So if your client is suffering from a recent back injury that could possibly be made worse by exercise, definitely refer them to a doctor or a medical professional before doing any sort of sessions with them. If you sign on a client who is seeing a medical professional about back problems, you should then reach out to that medical professional for recommendations discussing what you should do with them going forward as their personal trainer. Let's say you have a client that injured their back 2 years ago. The injury has mostly healed, but that client still has some pain that comes and goes. They don't want to do physical therapy, and they have several goals that they want to achieve with your guidance. What should you do? Well, in this situation, there are a few definite things that you should do. In fact, I will actually take this one step further. With the vast majority of clients that come your way with back pain, there are just a few things that you should implement right off of the bat.
Whether your clients have back pain from postural issues, old injuries, or anything else, you should 1. Do the proper screening. Do not skimp on your consultation. Do your PAR-Q, health history questionnaire, and your informed consent. 2. Do an assessment early on. And within that assessment, make sure to include a movement screen. This helps you to find movement patterns that could cause back pain for your client. 3. Have clients start slow. This one is obvious, but it's still important. And seriously, have your clients do exercises on the slower side. especially when you first start training with them. This helps to keep their form the way it should be. 4. Start simple and light. Pretty self-explanatory here. Do simple and light exercises when you start working with a new client, especially those who suffer from back pain. 5. Ask your clients how they feel. If you suspect that an exercise might be causing pain or discomfort, make sure you ask them about it. If an exercise hurts, skip it and move on to something else. 6. Strengthen their core. A stronger core protects the back. Plain and simple. 7. Do extra strengthening for the back side of their body. Your clients are going to have postural problems that either cause or make existing back problems worse. Do your part to help correct that. 8. Help them fix their lifestyle. Think about their ergonomic position at work. What position do they sleep in? Don't be scared to assign some light homework. 9. Don't forget about their other goals. Most often, back issues will be a sub-goal rather than a main goal. Make sure that you don't forget about their other health and fitness goals. And 10, refer out when necessary. Stay in your scope of practice.
If you do those 10 things with clients who have back pain, you will almost always be successful in reducing their back pain and also helping them to prevent future injuries. With all this being said, every once in a while you will encounter a client whose back issues can't be improved with exercise alone. When you come across a client like this one, refer out. Remember your scope of practice and don't be stupid. Not my most profound closing statement for a video, but it'll do. Anyways, I feel like we covered a lot in this video today, so if you guys have any questions or anything, don't be scared to ask them down below in the comments. If you haven't liked the video or subscribed to the channel yet, please consider doing so because it does help the channel to grow, which of course does allow me to make more free content for all of you. Thank you very much for watching, everybody. And until next time, stay sort of healthy.